Hello, everybody. Welcome to another episode of Rocklaz Radio. On today's show, we have Deepa Farnandes with us, who is a MIT Pirate, CTO, healthcare consultant, and she's here to help startups grow with her design models. And we're going to talk much more about that. So stay tuned till the end and feel free to drop your questions in the comments. Cheers. Great. Deepa, what do you do and what are you passionate about?
I'm passionate about healthcare technology. That's what I do. I've been a tech lead and working in healthcare my whole career and my education as well. And I love helping startups to grow, to understand what is their best strategy moving forward. And I really like to do that and enjoy that.
So you're passionate about healthcare, but you also have written few papers. So can you give a highlight on them and then we'll go deeper into each?
Okay, sounds good. So I have two published papers in peer-reviewed journals. One is in IEEE. It's an artificial neural network to classify swallowing and coughing for dysphagia. Dysphagia is what people with strokes have. Then they have a problem swallowing. It's been a problem for doctors to figure out what is the level of dysphagia or the difficulty in swallowing that these stroke patients have. And so I wrote an artificial neural network in order to take a transducer and put it on this bone and have the patient swallow and collect those signals and have this artificial neural network to classify how bad the swallowing disorder is based on their the amplitude of their swallowing signals and the strength of their swallowing signals. So that was the first paper. The second paper I wrote was more recently and based in rural India with studying maternal and neonatal survival initiative, trying to see how best to scale it using systems design principles and using systems dynamics modeling.
So let's go deeper into the second one. Maternal neonatal survival initiative in rural India. Mansi program.
Yes.
Okay.
So Mansi is a PPP program. It was a private-public partnership between the government of Jharkhand, the American India Foundation, and Tata Steel. So these three partners worked really well so one of them provided the money, the funding behind this program. The one of them, the Tata Steel, was the implementation partner. They had the trust of the people there, so they were able to go and implement this particular program. And the government of Jharkhand obviously supported all these efforts. So it was a program that was able to reduce the maternal mortality rate by 25%. And the neonatal mortality rate by 32%. So I studied this particular program to see what works well and what is the best way to scale it. And in order to do that, I built a model, a systems dynamic model, where I took all the stakeholders in this village and understood what are all the feedback loops in between all these stakeholders in terms of communication, word of mouth, and then the resources that were going around, and the number of healthcare workers there, who are called Sahiyas in Jharkhand, and then made a systems dynamics model to see what is the optimum number of Sahiyas and resources for a particular population. And I was able to identify that if the population increases, how many more Sahiyas are required. So I made a model which is using systems dynamics.
What are Sahiyas?
Sahiyas are the healthcare workers that are in villages. In Karnataka, they're called Ashas, and in Jharkhand, they're called Sahiyas.
Okay. Yeah, Sahi, like a friend. Okay.
Yeah.
What does a neonatal mean?
Neonatal is a newborn baby from the day they're born till they're 42 days of age. They're called neonatal. So there's the high mortality rates in this period. And so this is something that is being tracked by the WHO. Of course, maternal deaths are tracked, but also neonatal deaths are tracked. And a lot of the neonatal deaths are caused due to issues, with malnutrition with a mother, or basic cleanliness. If their surroundings are not clean for whatever reason, then infection sets in. So there are some few basic things that actually cause mortality both in the maternal and neonatal.
And what were your findings in Jharkhand about the neonatal? What is the leading cause there?
So it was mostly malnutrition, and that was causing anemia. So because of anemia, a lot of the mothers were bleeding out, and there was a high mortality because of that. The other thing was the infection rates, that sometimes the babies were born in the house, and something was just used to cut the umbilical cord. So the sahiyas were trained to get a new blade, to use something like fresh out of the packet, which is sterilized, and to use that to cut the umbilical cord, because that was a huge source of infection. Also, the sahiyas go and counsel the mothers and the families about the eating properly. So there were some cultural issues there in Jharkhand, in rural areas. There is cultural issues about food, nutrition. So there, in some cultures, in India, they don't allow the mother to eat an egg, which is like the most cheapest form of one of the cheapest form of nutrition. But there's some cultural taboos about pregnant women eating eggs, because they say that if the pregnant mother breaks an eggshell, then she'll have a miscarriage, and so they have these taboos which prevent them from eating well. So this is the cause of undernutrition, and so the sahiyas go and counsel the mother, the pregnant lady, and the whole family about eating right, about taking folic acid. And then the government also gives checkups. So then they counsel the family to go and have a checkup. And then if the baby is born in the home, they make sure that the umbilical cord is cut with a sterile instrument. But they also make sure to swaddle. So apparently some cultures, they don't cover the baby after the baby is born. And a lot of babies actually, there's high mortality rates because the baby's uncovered, and they get cold and they get sick.
Cover
So
as in they leave them open?
they leave them open, yeah. So then the sahiyas actually tell them to cover them up in blankets, and so there are some things, cultural things, that the sahiyas help to teach the families, and then this has ensured that the mortality rates have gone down. And then so these implementing partner like Tata Steel, for example, they not only train the sahiyas on what to say, when to go, but they also give them the tools. They give them blankets to cover the baby. They give them a weighing scale to measure the baby. They give some nutrition supplements. They make sure that the sahiya knows where the government is giving out nutritional supplements, so that she can give it to tell the mother about it. So they train the sahiyas, but they also give them the kit. They have a kit, and so they make sure that their kit is fully stocked. Also antibiotics. The kit carries antibiotics. Also carries a temperature thermometer, so that they can take the temperature if the mother is showing any signs of distress, or the baby showing any signs of distress. They teach them a few things, and so that they can at least be there as a first line of healthcare support to the family.
What tips do you have for the mothers to reduce maternal mortality rate?
So it's about making sure that the mother gets good nutrition, getting folic acid, getting some iron supplements, eating well, eating protein, and also getting the regular checkups. And the government gives free checkups for the first trimester, second trimester, the third trimester. The government gives free checkups. So it's good to go and check the blood pressure, check the iron content, and folic acid. Make sure they're getting the folic acid supplements. So these are the basic requirements to make sure that mortality rate go down.
You said bleeding out due to anemia was also a big issue. So I believe that's the lack of iron in the blood.
Yes,
Where
exactly.
do where do people in the rural places find iron, and where is it naturally and cheaply available?
So a lot of leafy vegetables like spinach has iron, and but you can also get iron supplements. And I don't know if they have access to supplements, but definitely there are some vegetables like spinach that are rich in iron, and so it's good for them to have them, at least if they're not able to get iron supplements.
I think this is lacking in even in women in urban areas, because I donate blood every 3 months, and I was talking this with friends, female friends, and they were like, no, they cannot. I just found one in like hundreds of them who was able to do that because of the hemoglobin level and the
Oh
iron in the
gosh.
blood.
Yeah, if they have access to iron supplements, they should take iron supplements, because I mean, anybody requires iron supplements, and especially women, because of the menstrual cycles and pregnancy reasons. You need to have a lot of the hemoglobin should be right.
All right. Let's talk about system dynamics. What have you worked in that, and can you tell about that?
So systems dynamics is an MIT method that was built to model any kind of system. Actually, one of the professors modeled the Earth, and he put in the population, he put in the resources, the minerals, the water, the food, and he actually made a model of the whole Earth and found that the Earth can only healthily sustain only 6 billion people. And so we are already over that. But basically, go ahead.
Is he proved wrong? Because you're already 9 billion now.
But see, he made it so that his model said that everybody should have access to all the resources. And right now, people are there who don't have food or don't have water. So I think his model has some credibility because of that. But
it's not healthy.
Yeah, it's not a healthy, existence if we are so overpopulated and the resources are lower. But basically, what system dynamics does is just takes all the resources or all the people and the feedback loops. Some feedback loops are positive, reinforcing, and some are negative, and they actually cause bad things to happen. And so you put all this into a system and you look at the loops, and then sometimes the negative loops are higher, and that means our climate is increasing because some of the negative feedback loops are causing this problem. And then there are some positive feedback loops that also make things better. And so you kind of want a system where the positive and the negative are not only the negative is not very high, first of all, but the reinforcing loops, and the positive loops are able to give make the system work better. And so what I did was I mapped out all the resources in a village. Go ahead.
Just before that, simplifying system dynamics, when you said loops and modeling, is it all on computer or is it something physical?
They're all causal loops on a computer, and there is a software called Vensim, and Vensim makes it easier. You can draw it out. Actually, you can take all the people in a system and draw out all the loops, and if you take all the resources, draw out all the loops, whether they're positive, reinforcing, negative loops. They're all causal loops. They all make something makes it happen, and so there's all these connections with all these different people and things, and so you can draw it out on paper. But there is a software called Vensim that you can put in all your...
By loops, you mean ifs and buts, like if this then that questions?
No, it's just connecting loops. So it's just that suppose a person needs to go to the market, and there's a vegetable vendor. You are giving money to the vendor, and that is one loop, and then you're getting vegetables from this vendor. So that is the other half of the loop. So it's a loop. You and the vendor is a loop. So between you and everybody else, there are loops. You're getting something, you're giving something. Or there's conversation, or there's word of mouth. Like between you and me, there is a loop now. I am talking, I am listening. You are talking, you're listening.
So every transaction or every interaction is a loop in that system.
Yes. And some are reinforcing loops where things get better, and some are negative loops where things get worse. And for example, climate change is a negative loop where the temperature is going up and up because of some other counter things that are happening. There's more pollution, and so some of those are negative loops, that the more the fields are burned, there's more fog in the air. Those are like negative loops. And whereas a positive loop is the more vegetables I buy from the vendor, maybe the vendor gets more profit and the vendor becomes richer. So that's a more positive loop.
So you have
So
modeled the healthcare delivery system in India, in rural India.
In a village, yes.
Can you tell us about that? What was the reason for doing it and what was the model like?
Sure. So the reason was to understand what is how is the feedback goes around, and what is the loops in a village. And basically the loops in a village are that there are the pregnant ladies, there's the village head, there is the government, there is the Tata Steel, there is the Sahiya, there is the family. What are all the interactions between all these people in the village? And what happens once a lady gets pregnant? How does she get the right healthcare? So what are the things that go into the right healthcare? So first of all, she has to register, or some between her and the Sahiha, there has to be some sort of interaction where she is accepting that she is going to take the help of the Sahiha. So that is the first interaction, and I label that as a registration fraction. So this registration fraction is very important because however many pregnant ladies are there and however many Sahiyas, they have to interact with each other and they have to register with each other. So if you have 100% registration fraction, that is very good. That means all the Sahiyas are interacting with all the pregnant ladies. Whereas if you have only a 50% registration, that means only 50% of the pregnant ladies are registering with the Sahiya. And so you want a higher registration fraction. And so that is the basic loop here that in the village that I'm interested in, the dynamics. So how do you make sure the registration fraction is high? And that's the loop here. First of all, there has to be good communication in the village. So the Sahiya knows when somebody is expecting a baby. And so but then on the other side, the Sahiya has to have a good reputation and a good friendship circle in the village, that when somebody is expecting a baby, that they go to her and they are accepting of her advice. So the whole village dynamics and the people involved, I set it up in terms of loops, in terms of communication loops, because in a village, it's really word of mouth that everything goes. There's not really TV or newspaper or anything to tell you that all these are happening. And so then I built this model to say what is the positive loops, what are the negative loops. Sometimes if there's a mortality in a mother or a baby, how does that affect that loop, that word of mouth, that whole dynamics in a village? So those were the things I connected and made a village so that I understand from graphs and it'll tell me, like, if I increase the population and if there are no adverse effects, things happening in this loop, then how many Sahiyas are required. But if there are adverse things, if somebody is not happy with the Sahiya for some reason, or there's a mortality situation happening in the village then how does it affect the dynamics? So this is what I did.
How much time did you spend there for this project?
I was there for a month, I think, for a month in rural Jharkhand. And then for a few days, I also toured rural Andhra Pradesh and rural Karnataka, just to have a comparison about what is going on about healthcare in these other states.
So you literally went on the grassroots level and noted down all the loops, what affects what. Is that what you did, or?
Yes. So I went to rural Jharkhand and visited a lot of families, visited Sahiyas, visited pregnant mothers, visited one family where their baby had survived because of the Sahiya's help. And they're so grateful to that Sahiya for making sure the baby survived. And because the baby was a premature baby and the baby was delivered in the house, but it was premature, but the Sahiya went every day. And apparently one of the things that they made sure the baby was survived was because they kept the baby warm every day. They made sure that the baby, because there's no incubators in rural areas, so they actually covered the baby in many blankets and actually even put a wood stove apparently near the baby to make sure the baby was warm. But the baby survived and the family is very happy. So yeah, I visited them. So I visited, then I visited even the government center to see what is the facilities that are being delivered. So I went and talked to all the stakeholders basically.
How can the viewers benefit from this system or this model that you have set up?
So I didn't set it up. It was already set up. I went to look and see how to scale this. So it was working well in Jharkhand. And now these PPP partners, which are American India Foundation and Tata Steel, they wanted to do this in Orissa and also try to scale it in any of these areas where mortality rates are very high. So surprisingly, the mortality rates in rural India for maternal and neonatal are on par with the mortality rates in sub-Saharan Africa. So they're very bad. They're one of the worst in the world in terms of mortality. And so there is the WHO and are asking about these numbers, and so they're looking at these numbers as a evaluation of the progress that is made in any country. And India actually looks bad, even though our GDP is doing really well, and our cities are growing, and it's very sad that there's mortality rates are still high, the same on par as the sub-Saharan Africa. And so there's a lot of people looking at this value. And so there's actually even the Bill and Melinda Gates, they work in different states. I think they're in Bihar and some other states. So there's many nonprofits that are trying to help to improve this mortality rates. Why this particular system worked is because they had the trust of the people. Tata Steel was an implementation partner, and implementation partner has to have this trust of the people. Otherwise, the sahiyas are not going to go for training. The families are not going to allow their daughters to become sahiyas or their daughter-in-laws. And even if a sahiya goes and gives information to an expecting mother, they may not accept it because if they don't have the trust of the implementing partner. And so that was one of the big reasons that this particular program worked, because Tata Steel has been in that area for, I think 100 years or something. And so the villagers were willing to go send their daughter-in-laws for training and listen when the sahiyas came to them. And some of the sahiyas, actually, it was a pride for them that they had become sahiyas and that they were helping. And so, but it was also, so that all was that is a positive response to this. And so, that all worked, I think, because of this whole trust relationship with Tata Steel. And so also that they were willing to, expand and scale in states where they have a presence. Like in Orissa, also they have some plants, and so it made sense for them to expand there. But I don't see that the other nonprofits have had that much success, because sometimes they're just coming in from outside, and then they have to have a very strong implementation partner, and that implementation partner may not have that wider area of focus. And so, sometimes these things don't work unless you have that trust, and building up that trust takes a long time.
Amazing. If you had to list your expertise in healthcare, how would you say that?
So you want me to rate my expertise?
No, the next question is going to be, how are healthcare startups going to benefit, or can they benefit from your services? So that's why the precursor question was, what are your expertise?
Okay, so my expertise is to use systems dynamics models to scale a system, but also use systems design principles. So MIT also has systems design principles where a system is a socio-technical system. It's there's people involved, and then there are technical systems that are involved. And so how is this set up together? How are they set up so that they work well with each other? They're user-friendly. They, do the job that they're doing. So first of all, you have to understand the systems design part of it, and then the systems dynamics part of it. And I use these are my strengths, and that's how I have helped startups and even established companies to scale based on these principles.
So can you give an example of systems dynamic principle?
So systems dynamics is basically the interaction and the feedback loops and registration fractions. So that those are the basic principles in systems dynamics, making sure you have, and both systems dynamics and systems design, I think one of the basic principles is understanding who are all your stakeholders. So the environment might be one of your stakeholders. So whatever you do, you cannot be putting all the waste into the nearest river. You have to be thinking about all your different stakeholders in the system. You have to think about the people that you're going to affect with your product. You have to think about the government. You have to think about regulations for healthcare products. So there's all these stakeholders. It's not only the technology that you're trying to create or the customer that you're trying to find, but it's a bigger system that you need to understand in order to do systems design or systems dynamics.
Amazing. Can you share an anecdote of the success from your system? Can you share an example of system design principle in action from your previous startups?
Sure. So in systems design has a few principles, and the basic principle is that you have to understand what is your problem statement. So anything you design, you have to understand exactly what is your problem statement. If you're doing healthcare, you have to understand. And we used a phrase which was to fix something by doing this and using these things. So every problem statement had to have this to by using framework, and so I've worked on maybe 6, 7, 8 ideas now, and out of that, only 3 have actually become MVPs. And the ones that I've designed I've made sure that they have been designed knowing exactly what is my problem statement. So my problem statement is to have access to the doctor by your voice over IP using telemedicine, and also it would be an example of a statement. And so with that, this is a telemedicine product using your voice over IP or your video over IP, and connecting, giving access to the doctor. And so this is one of the examples. One of the products that I worked on that has become very successful has been a telemedicine one, but it gave access to the doctor and the patient, and also chat access. So it was almost real-time access, but it was also being able to see your doctor from your home.
So what was the startup before they approached you and after they got your help?
So the startup was actually in process already. And, so I was on the insurance side, the healthcare insurance side, and so where I was pulled in was to try to figure out how to not only have a product that connects the patient to the doctor, but also have their insurance information in there, and so that as soon as they are able to connect, you know what their insurance status is, and so you can connect them faster to the doctor because you see that they have insurance, and so and because you know that they have insurance, you can also figure out what is the copay, which is the amount of payment you have to pay in order to see the doctor, even if you have insurance. So this improved the access because now the doctor also knows you have insurance and you're able to pay, and the patient also knows, okay, this whole interaction is going to cost me this much. So that improved the usability of this product and the access between the patient and the provider. Where I got in is I was asked to make sure that the insurance side of things worked out very well, and so I worked with the people in the insurance to make sure it was very seamless, so that as soon as somebody connects, as soon as they put in their phone number or their some ID that they have, which is unique, that it connects to the insurance systems, and then the insurance systems are able to make sure that are able to to give the information right away back to say how much is the copay, what is the charges for this particular call. And so that was my side of this. Using systems design principles, I helped to make it seamless so that it was very easy to get this information. So the information was easily available from the insurer side and fed into this product in an easy way so that it didn't take up too much time and was useful for both the parties.
Wonderful. So you made it more efficient and fluid, and that might have even saved their cost in the long term.
Yes.
Going a bit deeper into system design principle, how would you explain it to a 5-year-old?
So systems design is, if I had to explain it to a 5-year-old, I would say, try to think about if you're making a product that is going to be like a sofa or something, you have to understand who are all the people who are going to use this sofa. Are they going to be tall? Are they going to be small? Are they going to be, going to be relaxing, going to be put up their legs? You have to understand who are all the people using this sofa and what are they interested in doing. Are they just sitting? Are they lying down? Do they need to rest their legs? What is it? So who are all the people using the sofa are going to be the stakeholders. And you have to even think about who's going to be making the sofa, who's going to bring the sofa to your house. So these are all the stakeholders and what are all their needs. So somebody has to design it. That means they have to have the material. They have to have they have to know what are you going to do with the sofa? Do you need leg rest? Is there a small baby going to be there? Do you need like some sort of support for the baby? Like you have to understand all the stakeholders, all their interests, and design accordingly.
What about, when I search for system design principle, there are more terms associated with it. So with this example, can you give who's what in this? So like, for example, power structure, flow of knowledge and finance, a basic problem statement, system design, and process and project management.
So here with an example of a sofa, you have to understand the flow of information. So we have to we have to write down who are all the people using this and what is the information will be, what are their needs, how much are they willing to pay, what is the material they want, what is the height they want. So these are all the details and this is all the information that needs whoever is designing the system has to understand. And then they have to send this information to the people who are actually going to build it. So there is this flow of information now between the stakeholders' needs and the person designing and then the person building it. And then you have to understand the power dynamics. Who's the person paying for it? That's the power dynamics is where's the money coming from. Typically, the head of the household would be paying for it. So then you have to understand what are their needs as well. They maybe don't have money at the end of the month, but they may have money in the early part of the month. And so you have to understand what are their interests. Also, the person building it, they have wanting to pay their bills as well. So they might need their money in a certain framework. So that is the power structure here about, where is the money flowing from and who has the most say in this matter. And it's usually the people with the money. And so you have to understand that. So then the process part of it is trying to make sure that the stakeholder needs here and are written down in a way that the people who are going to build it are going to understand clearly what is in their language. Maybe they want something in centimeters, so we have to make all the measurements in centimeters and send it to them. Or maybe they want their measurements only in Hindi. So you have to make sure that they're all in Hindi and in centimeters and send it to them. So that is the process. What is the process of writing the requirements down and then the process of sending the requirements? And then the project management part of it is understanding when the needs will be written down, when the requirements will be written down, when the requirements will be sent, when the when the sofa will be built, when the sofa will be sent back. Those are all project management. So there's a few aspects here of systems design that we have to think about. Not only this, but it starts with the stakeholder. What is the basic need here that we're making a sofa for? Is the basic need is to sit on. So we want something. So we have to think about all the things that somebody wants to sit on. It has to be comfortable. It has to be the right height. It has to be the right material. Like so many things come into play. So you have to think about all those aspects and make sure you design it that fits all the stakeholders' needs and has a right process so that nothing is left out, and then it has to be delivered in the right time and paid in the right time. That's a project management side.
Very well explains the concept. Thank you. About you also talk about ideation and product development in startups. So can you tell more about that?
Sure. So I think of startups as, or any innovating company actually, as creating small innovation loops. And small innovation loops are very important. So small innovation loops, and I call it small is because you shouldn't go and build a whole stadium before you decide, whether this is the right problem statement and you're building a stadium for the right people, for the right sport. You should actually find out, first of all, who needs a stadium, where should it be built. There are many things you have to think about, and I prefer to think of things in small innovation loops. So you make, especially for when it's a product that it's new, that is coming onto the market. If you're building a sofa, you need to understand the small things, right? You first, if you're not sure, if you're going to build a design that is very new and a sofa with maybe a curved back or something that is very new, you want to get feedback first. So it's better to do innovation in small loops. You do something new first, and then you get some feedback, and then you take it back and see, okay, did they like it? Did they not like it? And then build on it. And so that whole part of trying to figure out whether you have the right problem statement, the right solution statement, those are all ideation. It's called ideation. And usually there's a framework that I learned from another place that I use. So a first stage is called discover, where you're trying to understand what is your right problem that you're trying to solve. And then the next stage is define, where you're going to define what is the exact problem statement. And that also could change. One day you might say, okay, I just need a sofa. But the next day you might say, maybe I need only a stool. Maybe this person is only going to be sitting for 2 minutes in the veranda. They maybe just need a stool. They don't want a sofa. And then, so you have to really understand what is your problem, what is the right, and then what is the right solution to statement. And then you start designing the solution, and then you develop your product. So this is all ideation, and all of this takes time. You cannot rush into it. It's better to get a lot of feedback. I found with the different products that I've worked, the products that had more feedback in the beginning have worked much better. I worked on one product that we decided to roll it out, but the onboarding was actually tough because of something with the Apple Store, and somehow that turned off a lot of our early customers. That product never really took off, and I see. And then this other product that I worked with, we had a lot of feedback from UI UX designs, from the early product that was created, how the user used it. Like we had so much feedback, and that product has been much more successful. So these small loops and trying to figure out what is your right problem, what is the right solution, getting feedback. These are all really important in a startup.
If you're standing on a stage and in the audience there are many startups of different fields, whom would you invite to you? What are the characteristics of the startups that would benefit from you the most?
So I use these design principles, systems design and systems dynamics principles for a lot of startups, as well as the frameworks of discover, define, design, develop. But mainly my focus has always been healthcare. So anything in healthcare that is moving the needle towards giving better patient access, having better patient outcomes, having better patient experience. Those are the things that I look for. The other day I was talking to a startup that had this cool cancer care, and they had done a lot of research, and they're doing a non-invasive way of finding that people have cancer. And I thought that was so interesting because so some of these, I think, because of them supporting my interests, which are basically patient experience, patient access, and patient outcomes. Those are the ones that I will lean towards always.
And you also help in the software development cycle, right, for the healthcare products. So can you give some examples of that?
So there's different stages in software development. Even though it's just we think of it as software, and it's a black box in some people's minds, but it does go through phases of trying to understand the design. The design is the first part of it. But then from design, it's usually getting your basic stakeholder understanding, stakeholder needs, and making requirements out of that. So that is design. And then the actual coding part of the software. Then there's a testing part of the software. And for healthcare products, especially if there's a regulation point there, then there's the regulation part of it, where you have to make sure that you meet the country's regulation needs before you release the product. And so there are different parts of a software development lifecycle for a healthcare product that are different from typical other healthcare products. Other products that are not healthcare don't have that regulation piece to that extent. Some of them do, to a smaller, lesser extent. But in healthcare, and especially if you're doing diagnostic type products or software, or you're doing therapeutic products or software, there's a larger regulation part of it that goes into the release cycle of a product. So you have to make sure that, and the other part of it is, because of the regulation, there's a lot of process has to be documented. How did you come up with the idea for your problem statement? How did you come up with your solution? All of this has to be documented. How are you coding? What kind of coding standards are you using? How are you testing your code? And there's unit testing, integration testing. All of that has to be written down so that there are records to show the regulatory bodies that all these things were done. The other part of writing a healthcare product is that you have to get clinical feedback. So the regulatory bodies want you to talk to somebody from the clinical side, either a nurse or a doctor. Make sure that you understand what you're trying to solve from a very clinical point of view, and that whatever you are creating is not only has to show efficacy, but it also has to show safety. So safety is a very important part of the regulation, so that whatever you're creating has been looked at many angles and tested, and it's safe for the patient. It should not create any adverse reactions to the patient. So safety and efficacy is the focus of regulatory body. So your process has to be documented, and then you have to make sure you also comply with different standards. So there's IEEE standards, or each country has their own standards. And so the regulatory bodies will ask you which standards have you complied with, and you have to make sure your process has been documented, and all that goes into the release cycle.
Wow. There's so much to gain from your expertise. You have such detailed knowledge on all the levels of the cycle. Next question would be, what are different type of healthcare products?
Okay, so there are many different healthcare products, and interestingly enough, nowadays they're actually coming together and now talking to each other. But you think about it from a patient's point of view. That you feel sick, so you maybe go to the doctor when the doctor is writing down notes. So there's an electronic medical record, and that's maybe that's one kind of healthcare products. It's software oriented. but it has a lot of information about the patient. And so it has to be very set up in a very secure way, so that your patient data is kept securely and also backed up. So that's one kind of healthcare product. The other next kind of healthcare product is the devices. So when you go to the doctor is checking your temperature, your blood pressure, your oxygen content, and those are the very basics for your vitals. But it could be larger things. You could be getting a MRI or a scan, a PET scan. So there's all these are medical devices, and so they have their own standards and they have their own ways of being built, and they also have their own data formats because they are usually built by other companies, big medical device companies, or nowadays are a lot more smaller companies, but that's one type of medical product. Then the big MRI scanners, for example, or the PET scanners, they create images, and so now you have image processing software and image scanning software, image tracking software. So, and now there's also AI that reads images and makes markers out of that. So there's a whole type of product called image processing, which has its own formats and it has its own expertise, people working in that kind of work. Then of course there is the genetics type of product where people are trying to read your genes and try to understand what your susceptibility to different types of chronic diseases are. So there's this whole form of healthcare called genomics. And there it's not only trying to understand your genetic profile from your blood, but also trying to understand how you would react to any particular drug, maybe, or any type of therapy, or for cancer or for different kinds of chronic things. So there's a whole field called genomics, which is another type of product where it's software, hardware related as well. Then there's the pharmaceutical industry. That's a huge industry where they're creating medicines for people. And so that's a different type of industry that is also in healthcare. Then there's the life sciences side, which is more of the people who are doing tissue engineering and understanding your cell culture, or nowadays are growing like artificial cells. The other day I was talking to a doctor who they grow artificial cornea lens for your eyes from in a petri dish, and so that's a whole tissue engineering. That's a whole different silo or a different product type of healthcare. Then of course there's nonprofits who deliver a lot of services to the for healthcare. So yes, so if you think about it, I hope I got all of that. There's also lab data. So if you go, when you want to get your blood tested, you go to a lab, and so that's a different type of data. So it's actually coming to a place where now there are all these different bodies are trying to talk to each other, and that has not been the case before. One of the reasons is there's not enough data standards for exchange of data. So if you don't have the same data elements in each of these different product types, then it's difficult to exchange data. So that has been one of the problems. The other problem is that has been each of these products have huge amounts of data, and so people are still trying to figure out what is the value of exchanging this data, or what is the value, or what is the types of data that needs to be exchanged, how best to put them all together to make sense actually of any particular patient. We're moving towards a place where hopefully if a doctor is seeing some problem when you go to the hospital, maybe he's able to get your images right away on the electronic health record, and your lab data and your genomics, and to see what are your allergies to the different types of drugs, and you're and able to see this whole picture on one screen, and understand you as a patient better, and treat your condition better. I think that would be a very good thing. So I'm looking forward to a time where having all this information available for a patient.
It's such a vast field, and regular folks think of healthcare as just doctor and medicines, but there is so much opportunity in healthcare. Thanks for sharing those channels. I'm very curious. I read an article. What are your views on artificial womb?
Yeah, actually, I was reading something today too about it. I'm not sure about, where this need would be used. A lot of people nowadays are already using surrogates, for to have babies, and so not exactly sure what an artificial womb, why is it needed, or where it'll be used, or why. Yeah, I'm still trying to understand what is the problem statement here that they're trying to solve.
I know one. If you want an army like Kauravs, like you can have 100 babies at one time.
Okay, yes, I suppose you could, but I mean, we're humans, right? We're not like robots that you just put out a baby. You still need the babies to be taken care of and loved and, fed and cleaned and everything. So, it doesn't make sense really to have 100 babies being created at the same time.
Yeah, I mean, when my mom heard about this, she freaked out a little. Huh? Like, what is happening to the world?
Yeah, I suppose it could be scary. I mean, if you're making an army or something, it could be a little scary. But I think maybe there's a desirability. So one of the frameworks I use is like viability, desirability, and feasibility. Maybe there's a desirability here, but I don't know how feasible it is, and I don't know if it's viable. I don't know if you're going to produce 100 babies and you don't take care of them. How is this system viable? Like you need at least somebody taking care of them and making sure they're okay, and pampering them a little bit at least. And so I don't know how you do that if you have a factory for making these babies.
At one place, you're talking about reducing population, we're talking about automation, and Elon Musk, the people like him are making robots that can do all the human tasks. And there is the other side where people are talking about artificial womb so that many more can be created at one time.
Yeah, I know it doesn't really make sense unless you're trying to clone somebody, like, Dolly the sheep or something who was cloned. I don't know if you're trying to clone somebody and make 100 of that same person, and maybe that's the problem statement here, and somebody who wants to be cloned or something. That's the other thing. From a genetic material, where are you getting the genetic material for these babies? Like some of it does not make sense at all.
Okay, let's go to next topic. What is interoperability in healthcare?
Okay, so that's an interesting topic, and that's something I'm passionate about. And the idea here is, now all these different healthcare products that we talked about earlier, interoperability means that you can exchange data. So, and in if a doctor you needs to have all these pieces of information, and right now there are hospitals that are providing the doctors with images, with lab data, but what about your genomics data or your Fitbit data? If there's a way to, and interoperability is basically an exchange. So if there's a way to exchange this data so that if I am, going for a walk in the park, for example, but my heart rate goes up for some reason, is there a way that the doctor can get my information from from my watch? My watch is recording my heart rate, and my heart rate goes up, or I'm having a heart attack, or some sort of emergency situation. Is there a way for this data to be sent to my doctor, and for him to or to not only to the doctor or to the hospital, so that they can send an ambulance, or or to my family to tell them that something bad is happening. Interoperability is just basically exchange of information, so that there's a better patient outcome, so that I might have I have a better chance of living when I'm having an adverse problem, that the ambulance comes and gets me immediately. and the doctor is able to see me within a certain window, then I have a better outcome of for if when I'm having something, a heart attack or something like that, or a stroke. So interoperability allows for that exchange of information so that a patient has a better outcome, also has a better experience. So I don't want to be lying on the side of the road just because I've had a heart attack and nobody knows what happened to me. So that's my idea of interoperability, to exchange this healthcare data, so that also when I'm going to a new doctor, if I am able to share my data with a new doctor, instead of, so that the new doctor also knows that, okay, not only do I have maybe asthma or some other problem, but the new doctor knows that I had a fall in the park the other day, so they know that so that they can give me the right medicine. This is the idea of interoperability.
The smartwatches are collecting so much data from so many people. How can that be used? Or are there any products in the market that are already using this data?
Yeah, so there's a lot of heart rate monitoring happening on your watch nowadays. So but there's not only heart rate monitoring. There's your fitness monitoring, your oxygen content. There's many things being monitored by these smartwatches. And the other day, I posted on LinkedIn actually the top 10 smartwatches, or the mobility devices, and the Apple Watch is still number one in the world for all the things that they are able to store. They're able to your fitness tracking, your oxygen content tracking, your heart rate content tracking. They're able to track a few things, your sleep pattern. Then I was looking the other day, they tell you about your cardio recovery. So if you're exercising, how fast does your heart recover? Like, they tell you all sorts of insights like that as well.
What product can be made using these data?
I think it's all about giving you insights about your data. So if you have more data, is the insights that you're able to give more valuable. So suppose I had actually, I would like to have a product that not only gets all my images, but my healthcare data, my lab data, my genomics data, my fitness data, my food data, eating data, my sleep data, maybe my mood, my mental health data, and also gives me insights and says, okay, you didn't sleep enough today, so maybe you can plan accordingly for the rest of the day, or maybe you're not sleeping well, so you need to do some yoga or something like that. Give me some insights on that on a daily basis. But also, if I have a chronic problem, like if I have high sugar levels, then if I get some insights about you didn't sleep well and that affects your sugar levels, what should you do about it? I think that will be very interesting for me.
Quite interesting. Looking forward to see these. Uh, what are some products in US? You have spent quite a lot of time in US. Could you share some innovative products that are coming from US?
So I think some of the things that I've seen have been very interesting. Is in some places they have a drone bring you a defibrillator. If you're having a heart attack and you're walking in the park and you have a heart attack and you are able to call the 911 and say, I'm having a heart attack, they're able to send a drone to you with the defibrillators, and that is very easy. So anybody who's any passerby can actually put it on you and give you and make sure your heart starts beating normally again. So I think I think some things like that are very interesting. But also nowadays there's a lot of artificial intelligence in a lot of things that we do now. In the patient and the doctor interaction. Now there's a lot of artificial intelligence looking at your data, your images, for example, looking at your eye. So the other day I was talking to somebody who has a product for the eye, and just by taking a scan of your eye, they're able to tell you that what is your susceptibility to getting diabetes, or they're also able to tell you like things about your eye, that about your health, that you, or even your blood pressure, for example, like some things they're able to see just by taking a scan of your eye. And I think those are so cool, because nowadays these products are getting miniaturized, and so you can, there'll be a time we can do this in our houses itself. We don't have to go to the ophthalmologist for some things like that. But there's also, the other day I was talking to somebody who, nowadays there's patches for insulin delivery for diabetes. So you just put a patch on your body and you're able to go for a marathon, and you don't have to worry about something like that, like making sure your type 1 diabetes is kept in check. And so there's a lot more delivery systems, there's a lot more analytical systems. There's a better drugs nowadays that give you targeted therapy for the things that you're suffering from. And even, for example, the COVID vaccine, typically vaccines take years to come up. The very fact that the COVID vaccine came out in months was really, really impressive. So we're definitely moving to better medicine, better technology products and better guidance to the doctors, so that the products that they are using can help patient outcomes. And also there's a lot more focus with AI, with improving the patient experience. So there are a lot more chat facilities on your phone with doctors nowadays and hospitals. So at least that first level, okay, I'm sick, what should I do? At least that first level, there's a lot of chatbots can help you with that, and that helps with the user experience.
But who's going to use a chatbot if somebody's getting a heart attack?
Well, if you are connected to your hospital on a chat, you can say, I'm having a heart attack or something, and and hopefully help will come faster.
But imagine it is going on a loop like Siri or Alexa. Like, I didn't get that. Can you repeat?
Yeah, that could be a problem.
You spoke about patches, so that means stickers. If you
Yes,
just put a sticker on your palm, your body sucks the whatever chemicals are there in it. So does that mean the armchair that I'm sitting on every day, does my body like suck the things on it, material on the armchair?
I don't know that much about the skin, but I doubt the skin is that fragile. I think these kind of things have micro needles, like these patches that are delivering products usually have some sort of micro needles, and so they're able to deliver. But I think that I've heard that if you put some paint on your body, that does get absorbed by the skin, and there's some pain relievers also. There are patches that are put on your skin that the skin does absorb. So yes, so I think to a certain extent the skin is absorbing the things from your from your environment. I don't know what is the exact mechanism, and whether something on your couch can go in. I don't think that's possible though.
So that can be a part of the problem statement where we were solving the sofa issue.
Yes, can have an insulin delivery system in your sofa.
Or some vitamins like B complex and all. Just put pads of it and relax while watching your Netflix. You're having those vitamins.
Wow, maybe we come up with a new product now already. Sofa delivery of your vitamins and medicines.
Let's go. We are going to USP this, or we need to apply for the patent soon. Web3. We have in this podcast. We have talked to many people from different fields of Web3. And on the audio version, in the really early episodes, we also had a world famous IVF specialist. So you have experience about healthcare and Web3. So can you tell us about how blockchain can help healthcare?
So one of the things that is good about blockchain is that it decentralizes the information, so that now your information is no longer at the hospitals. It could be somewhere, and it also tokenizes it so that the ownership can be transferred easily. So suppose, and we talked about moving data from one hospital to another hospital, and this could be done easily with blockchain. That if my data is in blockchain, and so I only need to give you access to it and give you my token and tell you that this is the token to my healthcare, and then now the new hospital can access that data. So I think that allows ownership for the patients, which is a very, very good concept, I think, which is not really much available right now. The ownership of data is typically with your provider or your the insurance, but it's not with the patient. And so that would be really nice if you could use blockchain to take the ownership to the person, so that and make it easier for somebody to share their data. So if I want to share my data with this next doctor, I can share it. If I want to be on some particular cancer trials, nowadays they want an understanding of what is your particular demographics and what is your chronic diseases profile before you can be accepted into a clinical trials for any particular drug. And so I would like to be able to tokenize my healthcare and share it with whoever I want to share it, whether it's for a cancer trial or whether it's for a new doctor or for anything. I should have the data not only available but also be easily shareable, and I think blockchain will do that beautifully.
I was just imagining, we spoke about those smartwatches. Imagine taking all that information from people all around the world, putting it on the blockchain. You'll have such a huge database of health that is non-tampered with, which they own as well, and so many innovations can come out of it. What do you think?
Actually, there have been some hospitals that are trying it. I know Mayo Clinic was trying something. I'm not sure how far they got. There's some countries that there are very small countries that have tried blockchain for their healthcare, and they have been very successful because they're small countries, so their population is not that high, and so they're able to put all that healthcare data on a blockchain and have it be stored securely. Whereas typically healthcare data is a lot of data. By the time you put all the imaging and all your lab data and your electronic health record data, it's a lot of data. And so I think that for some populations have done it and successfully. But it would be nice to see if blockchain costs go down. Right now, the cost of computing things on the blockchain are a little high. Also, for if you have a large amount of data, and so I think that might be cost prohibitive also for healthcare. Because I was looking into blockchain a lot for trying to take the ownership to how to give ownership by decentralizing and tokenizing and making things very secure and unmutable. So I was looking in blockchain for healthcare. I think from a principles perspective, blockchain is really good for healthcare, but I think the cost might be a little too high at the moment.
Just assuming we have all the data of everybody on the world, how would you use data analytics on that? Even expertise in data analytics, that's what I'm asking.
So there's different types of data analytics, and we're moving more towards the prescriptive type or the futuristic kind of a model where you get insights. So it's not enough to say what happened in the past. That's the analytics we've done in the past. Is what are your you want to know about last month's data and for your diabetes, you can go and look at a graph for last month and say, okay, I was exercising, my insulin levels were manageable. I was not exercising, my insulin levels went up. You can see the data for last month, but that is useful to some extent. But I think the better types of data analytics is where you're looking at the future, and it's giving you giving you prescriptions on saying, like today, if I am being sedentary, if I get a warning saying hey, you're being too sedentary, tomorrow your insulin levels may be a little higher, then I think that will be more helpful for me, because then I'll be like, okay, I've been told that I should be doing this, so maybe I should be doing this. Or if my genetics profile says that I'm susceptible to, having high cholesterol, for example, and then my lab data comes back with certain abnormalities in my lipid counts. Suppose that data is merged together, and the analytics is able to tell me that, okay, you are, your genetic profile says you're susceptible to having high cholesterol, and your numbers are looking like your current lab data has come back showing some bad cholesterol data. Because of this, you need to go to the gym for 1 hour every day for the next 1 year or something like that. Like, if it tells me that this is what I need to do in order to get around a problem that I might have in the future, I think that's helpful. What do you think? Do you think that will be helpful for other people as well?
Yeah, of course. It will benefit in so many ways. It is essential, I guess, to have that.
Yeah, so that's what I think. I think all this data, by applying not only AI, but by applying like these kind of prescriptive analytics tools, trying to understand, okay, so this all has happened in the past. But if I have my genomic profile and then it tells me what I'm susceptible to, then maybe I can make lifestyle changes so that the bad thing that might happen does not happen.
Just a segue. You mentioned about looking at the past and seeing the past records and telling what problem you might have. But there are these nadi pariksha people who will just tell about your health and symptoms just by feeling your pulse and heart rate. What do you think about that? They're saying live. They're giving you live information, not from past records or symptoms.
Well, hats off to them if they're able to do it. I don't know how they're doing it, but if it's really, happening, that's really cool. Have you seen it in person?
Yeah, I've got mine done 2-3 times, but it was just like for fun because I don't really have any serious symptoms or anything like that. So I just wanted to see what they say and how it is and stuff like that. It is a very ancient in traditional or Ayurvedic practice of diagnosis. Even in Bangalore, they do it. If you go down to Art of Living Ashram in the south in Kanakpura Road, they have an Ayurvedic hospital, and even in the ashram they have this. You should check it out.
Yeah, I will definitely. And so, if you have whatever they told you, was that correct?
I don't know. So I don't have any serious issues like that, right? So if I had some symptoms and they would have guessed it out correctly, I would be like, yeah, absolutely. But they were able to say some were very close to what it was. They were even able to tell about mind. So my issues are with mind, and they were able to tell about that. So what type of bath, pith, and cough they have these things to analyze. So that, and then they said something about liver, but I never felt any issues there. So yeah, if somebody, I mean, you should try it for fun, and if somebody has an issue, right, you should take them and see.
Yeah,
What
I
do
think
they say?
so. I know with Ayurveda, they are able to understand by feeling your pulse. Actually, they're able to understand all the things that you mentioned, and so they're able to diagnose things in that form. And I'm sure they're able to tell you even if you have a chronic condition. I'm sure they're able to tell you about some imbalance. But I'm not sure. It'll be very interesting to compare Ayurvedic and allopathy to see what is common and what is, how do you diagnose a chronic condition and how do you treat a chronic condition.
Maybe you should do a research paper on this next.
I wonder if people have not already done it. I mean, this kind of question has come up my whole life. Because my grandfather was a allopathic doctor during the day, but in the evenings he used to do some homeopathy actually for for like the poorer patients who couldn't afford allopathic medicines, because allopathic medicines are very expensive. He used to do homeopathy for them. And so I've always wondered, okay, what was the efficacy rates for allopathy versus homeopathy? How does it, how does a doctor prescribe two things, and like, how do they make that decision?
I find homeopathy to be a bit scamish, because I don't know. I mean, no offense to anybody who is taking that, but the science of it is like they take the antibiotic and they break it down to thousands of parts and they give it. So it's more like what do you call that?
Little poison or something.
No. Yeah, but it is very small portion of that. So it is like allopathy, but very small dosage. And what do you call that when that medicine doesn't have anything in it and you're just giving it like sugar tablets? There's a word with P or something for it.
Yeah, I am thinking of the word. It's placebo.
Yeah, placebo, exactly.
This is not a placebo. This is a very minute particle of the. It's not even the antidote. It's actually like the venom. Like if you were trying to treat a snake bite, they're actually giving you small parts of the venom back to you or something like that. So they give it to you in small doses, so you build up your immunity or your strength towards it or something like that.
Possibly. That's very interesting to see a research paper. So if you guys are watching, do comment and let us know about that. Let us talk about education. First, I wanted to know, why are you called a MIT pirate? And what is that?
So MIT pirate is a certificate. The most famous person who has been an MIT pirate has been Matt Damon. So he is an honorary MIT pirate. But in MIT, we were all encouraged to do sports and physical ed classes, and so the classes were divided into I think 12 classes a semester or something like that. But in order to get the pirate certificate, you had to take 12 lessons of archery, 12 lessons of pistol shooting, 12 lessons of fencing, and 12 lessons of sailing. So I took my 12, which was like 6 weeks each or something. So I took like 6 weeks of fencing, 6 weeks of archery, 6 weeks of pistol shooting, and 6 weeks of sailing, and I got my certificate.
So this is an actual pirate training.
Yes.
I thought it's just for the name and like something cool, but you're actually trained to be a pirate.
Yes. Yes, and we get a certificate, and so when we go and collect our certificate, they make us carry one cutlass, like a paper cutlass, and then put a fake parrot on your shoulder and take a picture with your certificate.
So have you used these skills secretly in practical anywhere?
No, but there's a spin on the word that. So MIT people like to hack things. So and recently, actually in Bangalore, we had a like MIT hacking medicine had come here for a boot camp. So the idea is to hack things is what a pirate would do. It's like not a straightforward way of doing things. It's like you're trying to do it in a hack, in a kind of kludgy way, but you're trying to find a solution, a quick solution. And in some ways, that's a pirate does that too. So that's the whole idea of MIT pirates. They're just basically trying to do things fast or in a new way. And so that idea of pirate, it seems cool actually in an MIT way. And that's one of my prized
items. Okay.
Yes, it's one of my prized certifications. So I have 4 degrees, but I actually value my pirate certificate more than anything.
So tell us more about your 4 degrees.
So I got my bachelor's and master's in biomedical engineering. And then I have a management degree from Harvard and a systems design degree, master's degree from MIT. So I have 4 degrees, 3 master's degrees. And the best part is I didn't have to pay for any of them. So for my bachelor's degree, I did well in the entrance exam, and I went to one of the best government college in the state, and so I didn't have to pay for it. And then for my master's degree, there was a professor who came to my engineering college and said that for the topper of the class, he would give a assistantship and in the US. And so I made sure I was a topper of my class. So I got an assistantship. When I went to the US, I had a research assistantship for 2 years. So I had a stipend and my tuition was paid for. So I didn't have to pay for any of that. And then for my master's degree in management at Harvard, I went through the extension school, which is for people who are studying and who are working and studying. And at that time, my company paid for my entire education because I was working and studying. It was actually very hard because it was basically, 2 days a week, like going to work till 6 in the evening and then going to school till 9 in the evening. So I basically the whole 2 days a week I was fully occupied with work and school, and then the other days I was occupied with work and homework, and so it was actually difficult, but my company paid for it. And then the last master's degree is at MIT. I got a Tata fellowship because the MIT and Tata had a center called MIT Tata Center for 5 years at MIT, where the Tata is actually the Tata Trust in Mumbai. They funded about 200 students, I think, in those 4 years to study topics that are for developing countries and especially for India. And that's how I studied how to scale this program that was doing well in improving mortality rates in rural India. So yes, so 4 degrees, never had to pay for it. So it's good.
So what are you doing these days?
I'm thinking of getting a PhD and I'm trying to get some funding for it. So hoping that works out.
And what will be your topic of the thesis?
I want to do data analytics. I'm interested in this prescriptive data and trying to understand the healthcare space. If you had all the data, can you prescribe to a person, what should be the changes in their lifestyle ahead of time to help them, especially if you have multiple problems. Like nowadays, you have a lot of apps that target one thing or the other thing. Like if you have musculoskeletal issues, you have an app for that. If you have diabetes, you have an app for that. If so there are apps for different things that are targeted, but there's no product that gives you a holistic idea of your healthcare. And so I want to actually work on an app that gives you not only has your data, so you have ownership of your data, but you also have some insights, prescriptive analytics of your data, and also have the ability to transfer your data or to share your data whoever you need. So you have ownership, you have ability to transfer data, and you have some prescriptive analytics or artificial intelligence telling you what are the changes you should make in your lifestyle in order to avoid the some things that you might get in the future.
That takes me to another topic, which is similar. What is digital therapeutics?
So that is digital therapeutics is these apps on your phone that help you with your chronic diseases. So there are many. There's actually, I looked up the other day and there are 90,000 healthcare apps on the app stores available nowadays. And they help you with many things. They help you with exercise. They help you with yoga. They're helping you with your eating issues, helping with mental health. They're helping with your sleep. And chronic diseases too, also cancer care. There's so many apps for everything. Maternal care, there's apps. Anything you can think of, there are apps nowadays. 90,000 of them, and they're all called digital therapeutics because they are on your phone, and so they're digital, and they're kind of trying to help you with your issues, your healthcare issues, and so because this is the terminology for it.
What's the point of so many 90,000 apps?
Well, I don't know. It depends. So the interesting thing is, while there are many apps, there is only 1 or 2 organizations that are actually rating these apps. So if somebody tells you this app ABC is very good and then you might go and download it. But otherwise, you don't really know what is this app and why should you download and why should you use it for. And so there's not been a very good way to compare these apps and see which is from a efficacy and safety perspective, because the regulatory bodies are not regulating them at the moment. And so there are many apps, and people, the doctors themselves don't know which ones to prescribe, the patients don't know which ones to use, and the insurance companies don't know which ones to reimburse. So there are many apps doing many things at the moment. There's a couple of bodies now that are getting some traction by having platforms. They're having platforms where they can rate these different apps, and they can compare them on on terms of security, data privacy issues. Those are really important things, because these apps have all our data on them, and so data privacy and security are very big issues. But then they can also rate them in terms of safety, efficacy. Do they really help you? How do you know if they're really going to help you? They say that you lose weight in 2 weeks if you take this use this app, but is that really true?
That's for us to try and judge. Is there any way somebody can find out apart from somebody else suggesting that okay, this app is good?
So that's this. There's a platform called Okra, so it's something like that. I'm not sure what the name is, but there are platforms now that tell you, that give you a rating and say, okay, we've tested this product, this app on these features, and this is the rating. So when you go, so suppose you're looking for a diabetes app, you can go to this platform and check what is the rating for in terms of efficacy, in terms of safety, in terms of data privacy, in terms of security. So you can, if you want to understand if this app is really giving you the information you need, then you can go to that website and check it out.
Oh, that's a cool hack. Thanks for that. When we are talking about this software development life cycle, you also have mentioned that. I mean, what are your views on SDLC for class 2, 3, and pre-market?
So the SDLC is the software development life cycle. So the software development life cycle is a process because there are steps, and so typically in large companies, there are gates for each of these steps. So if you have to pass through each of these gates. It's a process, and so every time you go from one gate to the next gate, so the first gate is the design, and then they want to make sure that they're ready for the next step in the process. The software development life cycle is very laid out in some industries, especially the regulated industries, which is class 2, class 3 pre-market. They have very clear steps, clear process. Things have to be followed in that way. For class 1, which is healthcare software, like digital therapeutics, for example, or any software that even EHR, EMR products, they come into class 1. And so they are not that highly regulated. So the process is not that defined, but typically for any software, it's good to follow a process, just because you want to make sure you have good quality, and quality comes if you follow some guidelines and some process. And so, startups usually are trying to get their product out of the market, their features, and sometimes they cut corners, but I would recommend not cutting corners in terms of the software development life cycle, especially for class 1. But class 2, class 3 pre-market, the regulatory bodies, they force some sort of process, and so you can't really cut corners, because if they audit you, they want to know what are all the steps you did, what are all the documentation for every step, for the design step, what are the documentation, what are the deliverables for the coding step, what are the deliverables, what are the unit testing you did, what is the integration testing, what are the clinical testing you did. Like, they want to see all the documents, and they want to see the documents signed by a few people. So it's difficult to cut corners if you are, and you don't want to cut corners if you're class 2, class 3 or pre-market. But definitely make sure that with the software development lifecycle to document all the steps and have a clear process.
So you can help out with these steps and give the guidance to any business they're looking for it, right?
Yes, so I help the healthcare software to make sure that they are not only set up to scale, but they have the right process so that they deliver on quality. So quality is very important, especially for healthcare. You want to make sure that this product that you're creating is effective and safe, and then the results should be repeatable, with the specificity, and make sure that it really is doing what it says it's doing. And so you want to design for quality and scalability. Definitely, I can help with the software development life cycle for that.
Amazing. That will be nice. So anybody wanting that, get in touch. Links in description. Okay, so small. You talked about loops earlier in the system design principles. So what are some small innovation loops?
So small innovation loops are when you actually create some new feature in your product and that you want to test it out and make sure that you get good feedback on that, so that you have the right focus groups to. So the best way to get feedback is to do either get some focus groups or get some potential customers to give you feedback on this product, or do a survey or some sort. So that is a small innovation loop. You do a feature, you get feedback, you make sure that you incorporate all the feedback, and then you release that feature out to the public. And if it's a large feature, then you break it down to smaller things, and then you do small innovation loops on each one of them. It's almost like a sprint. For example, in a sprint process, you have maybe 2 weeks of a sprint, but then you make sure that your product owner has seen this, seen the what you have created, and then it's marked as done. But then in your next cycle, make sure that the product owner takes your product, that particular feature that is done, out into a larger group, to a focus group, or to a group of your potential customers or your stakeholders, and make sure that you get the good feedback from them, because it's important to build the right thing, because you want your desirability to always be high. And in order for desirability to be high, you have to constantly keep in touch with your, not only your product owner, but also your stakeholders, so that you are building the right thing for them.
About a fun fact I want to share with the audience. You are shortlisted to be an astronaut. So first of all, why did you want to become an astronaut, and how was this process like?
So there was a time actually I didn't watch TV, but I was taking a walk, and I passed by one of the restaurants that had a TV that was blaring, and I could hear it even from the street. And when I passed by, they were saying on the TV that the NASA is now taking applications for their next round of astronauts. And so I thought, oh, that is interesting. Let me look it up. And so I went back home and I looked it up, and the application was pretty straightforward. There were some questions, and so I filled it out, and then they had a psychology part of it, which was like 1 hour long psychology exam. But they asked you whether you're claustrophobic and you're okay in tight spaces and all those kind of questions. And so I filled it out, and it was a January, I think, before COVID started, and they were supposed to give us the results by the June of that year. And so I actually filled out everything in one sitting. I just went home and I sat for like an hour and a half, and I finished the whole application, and then I submitted and I forgot about it. And then in June, I got an email that had 4 lines in it, and it basically said, "Dear applicant, you have been shortlisted for the NASA astronaut program, and but because of the because of the pandemic restrictions, we will let you know at a later date about the next steps." So that was June. And then nothing happened for another 6 months or 8 months or something. And I didn't actually tell anybody about it or anything, because I was like, I don't know. I just applied, and there must have been thousands of people. And actually, in reality, there was like, 20,000 people or something who applied. And the shortlist is only 100 people. So I actually should have been, more excited. But it was COVID and everything was under lockdown. So I wasn't really thinking too much about this. And so I didn't do anything about it. But after a few months went by, I started thinking, maybe I should look and see what the astronauts do for a living and like how do they train. And so I found that astronauts actually train for 2 hours every day in the gym. And they also have to make sure that they swim 3 laps in order to even qualify. So then I started, it was COVID, but I started learning to swim and making sure I could do the 3 laps. And I also started going to the gym and lifting weights, which I had never done before. And then the next, so almost some 8 months or something passed, and the next year came around and it was still COVID. And I got another email, another 4-line email saying, dear applicant, you're on the short list, and but due to pandemic restrictions, we are not interviewing right now, but we will let you know when we start interviewing. And then another few months went by, and then the pandemic restrictions started getting lifted, and then I heard that other people are getting interviewed, but I didn't get a call. But still, it's been one of my most fun things that has happened in my life, because out of the 20,000 applicants, only about 100 were shortlisted, and only 10 in the end, only 10 were selected. And out of the 10, so I looked up the people who were selected, and all of them had some sort of aerospace background. They were either, aerospace engineers, or there was a doctor that was, had been involved in some aerospace program. And so they all have had, between the 10 of them, they all had some experience with aerospace. And so they were selected. And, it looked like really a cool crowd. But anyway, it was a fun fact in my life.
Wow. So when you go to space, you'll be the first astro pirate.
I'll be the first. Yes. Yes, I would like that. I would like to be the first astro pirate.
Great. Actually, you're the third person on the show who has got something to become an astronaut. So first we had Dr. T.N. Suresh, who is from ISRO. So he was
nice.
shortlisted. He was shortlisted. He was the top one he was one of the 4 people who were going to go on the mission.
Wow.
But the program got cancelled because the NASA rocket exploded or something, and then the government canned the mission. But he was going to go.
Oh.
Second was Mike Mongo, who was explaining us about his experiences. He has been several times in zero gravity, and he's going to the space through Blue Origin.
Oh, very cool.
So yeah, so nice. It's an exciting space. Space is an exciting space. So, what do you like to do for fun? So
right now I'm into hiking, and I went to Nandi Hills in January, and to Skandagiri Hills last weekend. Also planning my next hiking trip. So so very much into trekking. In India, it's called trekking, and so very much into trekking at the moment. Just getting to know people, since I've not been in India that long. And recently, actually, this early part of this week, I was in Goa for the carnival with my relatives. So it's also been nice to meet, to get to spend time with my relatives now that I'm here. And so, a lot of good friendships, and a lot of, especially with the trekking group, it's been very nice.
Nandi Hills, that's the only place I hear when somebody talks about trekking in Bangalore. So yeah, it's on my bucket list.
So I went for the night hike. If you do it, you should try the night hike, because you start walking at like 3:45 in the morning, and it's all uphill. So you just keep going uphill for whatever. I think somebody told me 1,200 steps, and somebody told me 2,000 steps. I don't know how many steps it's really, but you basically are walking for a couple of hours at least till you get the top.
I have had an experience like that. In Pune, there are a lot of trekking venues. I mean, it's surrounded by mountains. So, Kataraj to Sihagar trek at night, the name is that. So, you have to, it starts at 7 p.m. at night, and it depends on how quickly you can reach. So, we ended up at 10 a.m. And there are 16 mountains.
Oh,
so
wow.
You have to go up, down, up, down, up, down, up, down, up, down. Like that. But it was fun because getting down was very easy. It was rainy and there was a lot of mud. So we used to just slide down.
Oh my God, that sounds weird. But so in Skandagiri, there was a lot. So in Nandi Hills, the steps were, at least there were steps, and they were cut cut stone steps, but it was beautiful. A lot of history, because I think the steps, they said the steps are cut in 1700 and something, and so it's basically like 300 years old steps or something. But still, there were steps. Whereas in Skandagiri, there was just rocks, and so you were either jumping, like trying to step over the rocks, or you were crawling up the rocks. And then if you crawled up the rocks, you could slide down the rocks too, but it was not very comfortable sliding on the hard rocks. Kandagiri was definitely much more strenuous than Nandi Hills, but it was cool. I really liked it. But we also went during the day, and it is hot. So I think that I now that after going to a night hike and a day hike, I still prefer the night hike, even though, while going through the night hike, I found it difficult because so dark, and you cannot really see anything other than what is coming from your torch light. So it didn't feel that good. But after going to the day hike, I think I prefer the night hike. So how long did it take you all to do all the mountains in Pune?
So 5 plus 10, 12, 15 hours.
Whoa!
That's fun. It was a lot of fun. It was not just a trek, it was a race actually.
Oh God.
So people are competing, and you had to be in teams. So 2 male and 1 female, and we're supporting each other and going, and like we were behind, but we were seeing, like, in 2-3 mountains ahead of us, we could see flashlights like crawling up the mountain. It was crazy. I mean, those are real athletes who were like in the front, who were leading. So, or people from the hills who live in the hills. So that was fun too. That was a fun experience.
Yeah, that sounds very strenuous. This Kandagiri took us longer than Nandi, but definitely not that many hours.
I even remember this Deotibba trek. So I used to take camps a couple of years ago to different parts of India for adventure and wildlife and things. So in Manali, there's this trek called Deotibba. And the fun about Manali or Himalayas is, like, it is so high that you take a stop one night, then you go up again. It's done on several days, and on all days you're just climbing up,
gosh,
up and up and up, and you reach to an altitude where the oxygen goes low, and there is no vegetation. There are no trees there, so it's just all clear. You are on top of the world, actually, like you are above the clouds. And it's snow there, and it's amazing experience to have.
Actually, we wanted to do the Valley of Flowers in July, so that's why all this.
Ollie? Ollie or something it's called, right? In Himachal. But Valley of Flowers is in Kashmir also. There are a couple of Valley of Flowers.
Okay. I think this is in Himalayas.
Yeah. So, Deepa, movies or books?
Movies. But so I do audiobooks. I don't mind. I don't read anymore, but I do a lot of audiobooks. So like each year I listen to maybe 1 year. Last year or year before last, I checked, I listened to 90 books per year.
Wow.
But I don't see that many.
How many books a week? Two weeks a week.
Yeah.
2 books a week.
So I listen to a lot of books. I don't see that many movies, but I don't read either.
I love audiobooks, especially the fictional audiobooks. They have so much drama and sound effects in it. It's pretty cool. Yes,
I love the Steve Berry. I'm listening to some Charlemagne Pursuit at the moment, and I really love the Steve Berry books.
I've never heard these names, but I'll check it out. I mostly read non-fiction. So there are a couple. Vikram and Vetal was the last fictional I heard, and it was pretty cool on Audible.
Oh, I should listen to that. So my brother's name is Vikram, so they used to call me Betal, of course.
Oh, so you would hop on his back and...
No, I didn't, but I should have.
You should record that as an Instagram story now when you meet Vikram and Vetal. Color your hair white and put some, paint everything white, so you look like a ghost. Yeah, it will be fun. Yeah. All right. So, what is your favorite quote that you always feel inspired by?
Quote. There's different quotes. There's some Gandhi quotes that I like, but off the top of my head, I'm not remembering any. Maybe I should look and see. So there's so the other day there was one quote that I liked by there's a poet usually there's a poet in the US that every president has sets up a or they appoint a poet. And this one poet, she was a young girl. She was like 16 years old, and one of her quotes was something about "be the light you want to see" or something like that. And I don't remember the full quote. That's what I think about a lot of, and especially because my name is Deepa, I think that I should be the light that I want to see in other people as well.
Wow. So it is similar to what Gandhi said, be the change you want to see.
Yes, exactly.
It's very interesting to know that. So be the change you want to see. And also about a quote about light I wanted to say was, there's this anecdote. There's a boy who walks ahead with a lamp, the light of which goes to 10 feet ahead. He walks ahead and he stops somewhere. Then a wise man from the behind comes. He's like a pandit or somebody whose lamp is just showing a light 2 feet or 3 feet away. And they both are approaching a temple which is on a height of a temple, on a hill, and they just keep walking. So this boy is sitting and this man approaches and the guy taunts him. It's so silly that you are carrying just a lamp at 2 feet distance and you want to reach that high. How are you going to go with that? So he says, I just want to see 2 steps ahead of me. I know where I'm going. So that in a way is it's okay to not know where the thing is. Just even if you know 1 step or 2 step at a time you can take, you still reach the destination. You don't need 10 feet or everything. You don't need to see everything to not take any steps ahead.
Yes, true. You only really need that, you know where you're going. If you know where you're going and you have a goal, you only need to, it's like baby steps. You only need to know the couple of steps in front of you.
All right. That's very fun. It was great to have you and talk to you, Deepa, today. Any final words for the audience?
I would love to see more healthcare innovations, more healthcare startups, more that is giving patients more access and better outcome. And I would love to work with all of these groups as well.
Absolutely. And where can they reach you? How can they find you?
So I'm on LinkedIn, Deepa Farnandes, and we can share the link. Definitely, that's the best way to reach me.
I'll provide the links in the description as well.
Okay,
and
sounds
one final question. How was the experience of the podcast today?
Oh, this was very good, Tanmay. You're a very good host, and you keep it moving, and it flows very easily. Really appreciate how good a job you're doing and how comfortable you're making me feel about this whole thing. Kudos to you.
Thank you so much. That makes my day. And we had a wonderful conversation today. Loved hearing about innovations in healthcare, and there's so much scope for business in healthcare. And of course, we can come to you for guidance on it for each level of whether it is compliance or finding a market fit or different levels of in the startups journey. For all the healthcare startups, definitely looking forward to your thoughts and following your thoughts or even on your social media. So thank you so much once again.
Thank you so much. Nice talking to Tanmay, and looking forward to hearing from your audience.
Hold on. This episode is brought to you by Tanmay Shah. That's me. Best way to support this show is by sharing this with your friends and dropping a comment and review on YouTube, Apple Podcasts, and Spotify. You can become my patron and a sponsor. That's not all. You can buy Rocklaz merchandise and NFTs and much more. See all the links in description for details. Rocklaz Radio with Tanmay Shah.
Rocklaz Radio.
Rocklaz.
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 Rocklaz Radio with Tanmay Shah.